Hey everyone, welcome to another edition of EDTalks. I have my friend Dan Mather with me. Dan, welcome to EDTalks.
Thanks for having me, Ed. It's a pleasure, and it's a pleasure to get to know you. And I'll tell the audience, if you haven't gone and watched your podcast or your YouTube, especially your lessons from mentors, they're really good. I've even extrapolated a lot of good information. So thanks for having me.
Well, no, it's great having you. When I met you, I felt like I knew you forever. It's kind of fun. So we just met at the Connexall user group in Boca Raton in what would it be, October of 2024. And I just felt like an immediate connection. Then when I heard you speak, you're an awesome speaker. So if you ever need an awesome speaker who's a MSN, RN, and does operations in real life at a hospital, Dan's the right person. And so I was so impressed, and everything you talked about really resonated with me. And I was like, man, I've been fortunate to work with a few people like you, but not enough of you. So it was just so refreshing. And that's what I want to unpack a little bit. But before we get there, you have like 5 kids.
Yeah, close. Yeah, 7 together. We're a
7.
blended family, so yeah, 7 together. But when you have kids, that just becomes your world. So you don't need a lot of other things. You just your kids, and they become your best friends, and then that's your life. So it's a great.
Yeah, I thought it was amazing because you don't meet that many people, that many kids. Yeah, I have 5 kids. You have 7. That's right. There was a couple more. I met your lovely wife, and it's just amazing family. So super thrilled to have you. And one of the things that you talked about was falling in love with simplicity, which I love that concept. So you're all about your operations, but you are all about leveraging tech to simplify and do the best thing for our clinicians, your fellow nurses, and other physicians, and then also for the patients and their families. So tell us a little bit about this philosophy of falling in love with simplicity.
Yeah, thank you, Ed. So it really is. My background is a lot of different things, but medically wise, it really focused on military to critical care. So I started out as a nurse aide and then worked all the way up into ICU nurse and cath lab nurse, and then into the leadership side of things. And so when I got into leadership, it was funny. My first career was actually as a mechanic. And so a lot of people don't know how a mechanic gets paid, but they actually get paid by the job they do. So let's say replacing an alternator on a 2020 Cadillac DeVille, it will pay you 1.2 hours. So kind of like RVUs in a way, you get paid that, whether it takes you 45 minutes because you're really good, or whether something breaks and it takes you 4 hours. So kind of early on in my life, I've always been really geared towards efficiency. I grew up on a farm, and so you're always trying to find the quickest, most efficient way to get the job done, most of it's tedious. So that's a little background that has grown me into healthcare. And then I've been blessed to lead several great projects here and then do a little bit of public speaking, as you mentioned, and consulting on the side. And so really, our healthcare workers and patients are so important to what we do in healthcare globally. And so I see so many things that are just complex processes. We just throw 10,000 solutions at a problem instead of actually trying to identify the actual problem and fix it. And we add more steps and we should be taking them away. Almost every process I look at, it's really is how can we simplify this and reduce it? A lot of times simplifying it takes more work in the beginning to do and to map out. But in the end, it's so worth it for your team. And ultimately, the most important thing is for the patient, getting high quality, safe patient care to the patient, improving their access. All of these things are so important. And I feel as healthcare leaders, that's one of our biggest jobs is to improve those things to the patient. So,
Yeah. Dan, can you share 1 or 2 examples maybe where you've gone through this simplicity process? You saw something that's complex and you worked with operations and tech and made it simple.
yeah, one, for example, recently, like in our specific orthopedic and sports medicine clinic, there are a bunch of different ways to do referrals into our system. I have a referral specialist who reviews them all. And then there was no real guidelines, what to refer to us, what imaging to have done beforehand. It was just kind of well, they should know. And well, no, they shouldn't. So we just designed a very simple referral guide. And then I deleted all of the possible pathways to get us a referral, except for if they're in our system, there is one. And if they're outside of our system, there's either a phone call or a fax. And And that's it. So really streamlining those into just those three pathways. And then the referral guide was able to list each provider, what they specifically do. And then importantly too, if we're going to see a patient, what x-rays and labs they can order beforehand, because we're having a lot of redundancy. People would get two x-rays because the primary doc would inadvertently or without knowledge order one that we need a 3-view versus the 2-view. So really streamlining all of those into an SOP, all right, easy to read, blasting it out system-wide and honestly state. So that was one that I'm really proud of. And then also just the fall project I spoke of. We basically were able to simply integrate our bed exit alarm, all right, to flow out to the nurse's call system. So they're tied together. So it sounds so simple. But before that, the bed exit alarm would go off edge, the staff would be searching around, trying to hunt down which room it was coming from. And all these systems try to sell me this expensive fix and complicated gadgets. And I was like, I just want the bed exit alarm to alarm the room outside. And when we were able to do that, and then we took a deep dive and we were able to get rid of a lot of the things that we do for fall restorations that just weren't valuable. Putting red socks on them, additional signage that we all had, just none of it really impacted.
Yeah, no, that's a great example. I think something that everyone can relate with, because 99% of the hospitals I ever served in and worked with, fall risk has always been a huge issue. And yeah, you do all these different one-off solutions, and they don't really work, but we keep doing them and keep adding them. But you came in there with a different mindset. It's like, okay, how do we simplify this and find the one thing that can really move the needle? So that's pretty cool. What would you say to someone who's listening, and maybe they're a pure operator like you, a CNO, or maybe even a IT person that's deeply embedded on the clinical side? How do you lead through this? Because that's the tough part too, right? Is sort of the leadership aspect. So what's sort of your philosophy on leadership and why you think you've been able to get these sort of things done?
It's a great question, man. My philosophy on leadership, if you read a lot of Kenneth Blanchard books, which I do and I love, is a servant leadership. And so I believe that my job as a healthcare leader is to give my people the tools, the resources, the people, the policies, the guidelines that they need to do their job. So my master's degree is in executive healthcare leadership, and they taught us a lot in that about, PI. And so you can go on a lot of great websites and find things that are step-by-step guides. But I think one of the number one thing that's missed that I see is getting your frontline staff. There's so many times we implement things for, like, example, for registration. Well, have we involved registration? One of my favorite things to do is to go to my staff and go, hey, if I could fix 2 things for you within the next 2 months, what would they be? And like we did that recently with registration. They were like, they had a one-way text messaging. So we would text a patient, all right, with an appointment time, but the patient couldn't text us back. And so I said, well, let's get that turned on where we can two-way text. And though you empower your people, you ask them for their ideas. And then since that, like, we've grown, and now the patient can ask, where's it located at? And they made little cues so they can actually send a link to a map, how to find where our clinic is. So, there's a lot that goes into it, but I think the one thing that I think healthcare leaders could do is you got to get 2 people. You have to get your frontline staff involved, and you have to involve your patients.
Yeah.
I round on patients all the time, and I'm always asking, were you able to find how to get to the clinic? In lean, we call those gimbals, really just following in the footsteps of patients. I challenge all leaders. If you have 30 minutes, just find a random patient, say, introduce yourself, and I want to follow you through this visit if I can. You will be amazed from entering the facility to registration or wherever else they go, the barriers patients that we are just avoiding.
I love it. Yeah, that's why I connected with you, man, because you told all sorts of stories like that one. And it's simple. And it's like, that's why we exist, right? We exist ultimately to serve the patients and our clinicians, and you got to walk in their footsteps. It's so simple, but yet, we're too busy, So you gave some great examples of simplification, and then the 3 or 4 points you made on leadership, and with the last one being on this sort of rounding concept, are so awesome. Why I think the world of you. I will put in the show notes how people can get a hold of you. So hopefully you don't get too flooded. Again, Dan's a great speaker, a great consultant, and a great operator. I mean, every day you do the things. and raise 7 kids and have an amazing wife. So, Dan, thank you for being my guest on EDTalks.
Thanks for having me. It was a pleasure for Ashley, my wife, to meet you. You can't be a great man without a great woman. I have one with you, so she's fantastic.
Absolutely.
Thank you. And I appreciate the invite and everything that you do as well. You are very, very busy. So it's an honor to spend time. And, just like this, I learned every interaction with you as well. Thank you.